Welcome to the new MODOC Medical Center. We are at the grand entrance here, and I will be your tour guide today. My name is Adam Willoughby, and I am the Chief Operating Officer for MODOC Medical Center. We will take you on inside. So due to COVID, we will have our screener staged right here in our main entrance vestibule. So this is the first person that you will encounter as you come into our new facility here. And once you've gone through the screening process, we will bring you on in to the actual main lobby here. So we are now in our main lobby for our hospital. So our new medical center consists of 3 buildings. So our hospital building, which we call building 100, our clinic building, which we call building 200, and our support services building, which is building 300. So right here is our reception desk. So this will be the first person once you are in the facility that you will encounter. And this person will direct traffic here in our main lobby, okay? So we're gonna move on over to our outpatient services waiting area here. And over here, we will have our admitting booth, as well as our patient financial services. So for hospital services, you will be admitted here. And for any billing inquiries or questions, you will come to patient financial services here. We will move on over. All right, so we are in our emergency services waiting area here, portion of our main lobby. So nice seating over here with some windows and a lot of ambient light. So moving on over, we are still in our public space, but once we go behind our door here, we will now be in our staff-only space. So we are gonna move into our emergency room here. And I want to point out that we have an ER intercom for after hours. So when our admitting crew is done for the day, we will utilize this, which feeds down to our ER nurses station, and someone will come out here and get you taken care of. So when we move through this door, we are now in the restricted corridor. So this will be staff only, unless you're being brought back for service. All right, so we are going to move into our ER triage room. So if you were here for ER services, this is the room that you will be brought to be assessed. So you will be brought in here and assessed, and then processed accordingly into one of our ER treatment rooms or back into the lobby to be called back in. So we'll move out of our triage into our ER corridor, and this will be one of our ER treatment rooms here. And so you can see we've got our head wall over here that has our in-wall suction medical air as well as oxygen. And we've got a monitor here for all of our physiological monitoring, which is all new to our new facility. So these are new provisions that we have. And we have 3 of these ER treatment rooms. All of them are exactly the same. We'll show you those as we walk by. Moving down our ER corridor. This will be our second ER room here. Exactly the same as the first one. Our third ER treatment room here with these breakaway doors. So normally these would actually be closed. We have them broke open as far as possible. Moving on down here. We do have a staff lounge over here. So this will be a staff lounge for our PR staff here. So it's equipped with, of course, your standard appliances here with our refrigerator, our microwave, and a coffee maker here. All right, so we are moving on down to our trauma bay. So this is our trauma/cardiac bay here. And we actually have a 2-bed bay. So you can see again, we've got our in-wall head walls here with our suction medical air and oxygen as well. So this room is a little bit larger than our ER treatment rooms, and will house our trauma/cardiac patients. The beds are coming over as existing, so that is why you do not see any beds in our trauma or ER treatment rooms. Those are coming over from the current facility. So we will move our way out of trauma, and we're gonna pop into our ER nurses station here. So we are down at our ER nurses station that will be manned 24 hours a day. And this is nearing the end of our emergency department. So we've got one more area to show you, which would be our ambulance entrance. And so anyone being brought in via ambulance will be on down here at our ambulance entrance. Ambulances will back up here, bring in our patient, and get them treated accordingly. One new space that we have in our facility is our decontamination room. So this decontamination shower would be utilized if we ever had an incident regarding contamination. So we've got an exterior door here, and so if someone was suspected to be contaminated, we'd bring them in through the exterior entrance here. We would decontaminate in our shower, and then we could process back out into the facility. All right, so we will move out of our emergency department into our MedSurg department. So this is our acute side of things. So moving into this area, you will notice we have another nurses station here. So this is our acute nurses station, where our inpatient nurses will be. And we've got our nourishment area back here. So all of our patient food and drinks will be stored in that nourishment kitchen there. We do have a medication room back here where our drug dispensing machines will be located. And then we will get into our actual inpatient rooms. So we do have 8 beds here on our inpatient unit. And this is a semi-private room. So this room will actually have 2 beds in it. And those beds are currently at the current facility. We will bring those over as we transition. Our inpatient unit consists of 3 semi-private rooms. So each one has 2 beds, so 6 beds there. And then we have 2 private rooms, with one being an isolation room. So we'll talk more about that as we get down there. Each one of our inpatient rooms is equipped with a restroom as well. So of course it has everything you need with a sink, shower, and toilet. So we will make our way out into our corridor. So we've got our second semi-private inpatient room there. Move through here, and we have our third semi-private room here, and one of our private rooms here. So basically the same setup as our semi-private rooms, but there will only be 1 bed in here, and there's only 1 head wall with our in-wall air, oxygen, and suction. Again, you'll see it's equipped with a restroom. Each bed will have its own TV as well. And we have 1 other private patient room as well that we will show you. All right, so moving from our private patient room to our stretcher shower. So this is a large enough shower room in order to get a whole stretcher or gurney in here. And plenty of room for nursing staff to do what they need to do with our patients. And this is one of our shower stretchers here. We will move on out and down our corridor here. So on this side is going to be our final inpatient room, and this is actually our isolation room. So you'll see it signed there. So you do not go in through the main door there. You would actually come in through our ante room. So through here, it's a separate vestibule that enters into the room, and it's a negative pressure room. So nothing leaves that room. So when you open the door, that negative pressure creates a suction. So if we have any of our patients with a communicable disease, such as C. diff, or if we had a COVID patient, we could put them in this isolation room and not suffer any contamination outside of this room. So we'll move on down to the end of our corridor here. We do have a family room. So this is a private space for families of patients to console each other. And moving on down, we've got our physical therapy treatment room here. So this is where our physical therapists will work with our inpatients, get them ambulating and active. Thank you for joining us on our virtual tour today. We are doing this virtual tour in segments, so please be on the lookout for our next installment.